And we welcome you back to our Thursday edition here on Channel 6 News. As you've probably noticed, we have a new full-time sponsor on the program each Thursday. It's Kaiser Permanente right here in Orange County. Joining us today, a very special guest, Dr. Edward Ellison, who is the Area Medical Director with Kaiser Permanente right here in Orange County. Dr. Ellison, welcome.
Thank you. It's great to be here.
Great to have you on the program today. A little bit about your background, your studies, and how you ended up with Kaiser.
Sure. Well, I'm from the East Coast originally. I was born in Virginia. My dad was with a large company, and we started moving when I was a baby about every 13 months. One of the places that we landed was here in Southern California. So although I moved back east, I knew I wanted to come back to California as an adult. I went to my undergraduate studies at Duke University in North Carolina, then the University of Virginia to medical school, trained in Florida, and then packed up my U-Haul and drove across country, joining Kaiser Permanente 24 years ago. I'm a family medicine physician, and I've actually had a number of your viewing audience here as part of my panel in my years past, so I'm really happy to be here today.
I know when doctors come out of medical school, they do have lots of options.
Yes.
One was for you who you'd end up working with or for, and you chose Kaiser. A little bit about why you made that decision.
Right. Well, part of it was the location. I wanted to come back to California, and then once I got to know the organization, I was really pleased with the decision that I made. Our organization is one where the physicians truly have a lot of infrastructure and support in helping us care for our patients. It's a coordinated and integrated model so that we can follow the patient across the continuum of care, which I think is really important to quality. And also the physicians own the healthcare decisions for our members. Although we partner with the Kaiser Foundation Health Plan, they are a nonprofit health plan, which means that more of every healthcare dollar goes back into caring for our members. And then as part of the Permanente Medical Group, and I am a Permanente physician, actually not a Kaiser doctor, we don't work for Kaiser, I'm a Permanente physician. As a Permanente physician, I make the healthcare decisions for my patients, as do all my colleagues, and that's really important to us.
Right. Your role, your current responsibility is overseeing. How many doctors do you oversee? How many hospitals here in Orange County?
Well, we care for 385,000 members. And we have two hospitals now, one that we have owned for over 30 years in Anaheim, and then the brand new facility that we just constructed in Irvine, and 18 medical offices across the county. I have over 500 permanent associate and permanent staff physicians, and probably another 300 or 400 per diem physicians that help us in caring for our patients.
So lots of folks and lots of specialties to help out whatever problem someone might have.
Absolutely, absolutely. We have a wide variety of the essentials of medical and surgical specialties, as well as many subspecialties to care for our patients.
The new hospital in Orange County is in nearby Irvine. Tell us a bit about it. You guys built it from the ground up, I think.
We sure did. We purchased the land about 10 years ago, and I've got to really congratulate my predecessor because it's a wonderful piece of property, so conveniently located between the 405 and the 5 right at Sand Canyon. And it's a state-of-the-art hospital. It's 150 beds, but we really built for the future because we anticipate growth. So we have another 100 beds that we could go into if we needed. We have 8 inpatient operating rooms and 4 outpatient operating rooms on site. And this hospital was really built to take care of our members for the next 30 to 40 years. It has a lot of flexibility built in terms of technology. We use the latest in information about how do you create a healing environment. Every room is a private room. Every room has a window. They all look out on a green space. We tried to create where the staff do their business to be away from the patient room, so to minimize noise and to make sure that it really promotes healing for those patients who need to be in the hospital.
I know overall wellness is the goal of your company and your organization. You really encourage people to have a healthy, well lifestyle as well as good medical care as well. But we're excited about having you folks join us here on Channel 6 and partnering with us from Kaiser.
Thank you.
What are some of the things we can look forward to in weeks to come? I think you're going to send some of your co-workers, some of your other doctors to join us here on the show.
Absolutely right. What we've done is to brainstorm a list of topics that we think that your viewers would be interested in hearing about. Everything from how do you prepare for your doctor's visit to make sure you get the most out of that visit, to what's important about prevention, anything from breast cancer, colorectal cancer screening, prostate cancer screening, so essential to our health to do those preventative care measures, to kind of fun things like chair dancing. How do you stay active if you're not that mobile? Arthritis, how can you be more flexible? We have Tai Chi classes, cooking for one. How do you manage through the holidays? It's a time when some folks really struggle with depression, or how do you struggle through all of those buffets that you go to through the holidays and don't end up on January 1st having packed on too many pounds? So we have a lot of advice around that. So many of my colleagues will be coming forth to talk about those sorts of issues.
Right. Well, I know our residents out here have a variety of interests and a variety of personal personal health concerns. If they have topics and ideas, can they submit them to us?
Absolutely. What we'd really like to do is to hear from your audience and have them call in to us and say, this is what I'd like to hear about. I think there's a number for them to call. And we'll make sure that we arrange for an expert in that topic to be on this program and to address those needs. So we brainstormed some that we think they'd be interested in hearing, but actually the most important thing is for us to hear from your audience. What's meaningful to your audience to hear from?
Right. Well, Dr. Ellison, we know you're very, very busy supervising all those doctors and all those hospitals. We do appreciate your time today. Thank you for coming by, and we welcome you again aboard on Channel 6. Thank you.
It's my pleasure.
Again, Dr. Edward Ellison, our special guest, and he's the Area Medical Director with Kaiser Permanente right here in Orange County. You'll be seeing them week to week right here on our program. Our Thursday program here on Channel 6 continues right after this brief break.